My name is Abelsohn. I'm a family physician in Toronto, and I'm an assistant professor at the Department of Family and Community Medicine and the Dalai Lama School of Public Health here at the university. I practice as a family physician, but part-time I work with Health Canada in the air quality health area, promoting the Air Quality Health Index. So I'm working within as a family doctor and in public health areas. The impacts are diverse. They're direct impacts, so heat is going to affect us more. Toronto is going to, the number of hot days in Toronto, days over 30 degrees, in about 20 years' time is going to double. So we're going to have about 30 days with temperatures above 30 degrees that are dangerous for health. In Europe, earlier in 2003, about 70,000 people died during a heat wave. So that's number one. The second direct effect is extreme weather events like storms, and these are going to become more frequent because there's more water vapor in the air as the temperature goes up. And so huge storms have tremendous effect. You can see that an example of this would be Pakistan right now, where, and I'm not saying that the storm there is directly related to climate change, but this is going to become more frequent. This sort of storm is going to become more frequent. And you can see the tremendous disruption to life, to food supply, to water security, displacement of people, and infectious diseases, which has tremendous health impacts. The other group of health impacts are the more indirect impacts, like air pollution is going to become worse, allergies are going to become more prevalent because the plants, the ragweed plant, likes CO2 and heat, and so will grow more and produce more pollen. Various infectious diseases will increase across the globe. In North America and Canada, Lyme disease, which is spread by the deer tick, will march northward because as the temperature warms, the climate is conducive to survival of the tick in Canada. In Africa, malaria will spread because with warming, the areas of Africa that are conducive to survival of both the mosquito and the malaria parasite will increase, especially at higher altitudes. In East Africa, the cities of Nairobi and Harare, etc., were built at high altitudes because there wasn't malaria there. But as the temperature warms, malaria will be able to survive in those areas. And then the greatest impacts are even more the indirect ones through, as I mentioned earlier, impacts on food security, water, and displacement of people, or climate migration. The impacts of climate change, right now the World Health Organization estimates that about 150,000 people die every year because of climate change impacts. Very few people are dying in North America or in Europe because of this. We produce most of the greenhouse gases, yet we're relatively immune to the effects of climate change. It's people in the developing world who didn't produce the greenhouse gases who will be mostly impacted and are being mostly impacted right now through infectious diseases, food, water, and displacement and security. So there's a huge moral question, ethical question here about who's responsible and who's being affected. There are a number of questions here. The first is this discrepancy. Should we be doing research in developed countries or developing countries? Certainly developing countries are most impacted, but we are going to be impacted as well through air pollution, through heat, through Lyme disease. So there's research that needs to be done. I think we need to educate health professionals, and I would say that every medical class should have a section on environment and health and climate change. And then there's intervention, and intervention by necessity is an interdisciplinary issue. If somebody comes into an emergency room with heat stroke, one of the issues in North American cities, physicians need to know about this and need to save that person. Family physicians need to know about Lyme disease. They haven't had to know about that previously, but in 20 years' time they'll be seeing Lyme disease. So we need to educate people. We need to do research about this. That sort of intervention and going a little bit more upstream, educating the public about Lyme disease, educating the public about heat stroke and the effects of heat so that they take care of themselves and look after vulnerable people and the elderly. That's called adaptation to the health effects of climate change, and so we need to fund that. But we have funding, we have capacity. In developing countries, there is not the capacity to fund adaptation strategies in terms of the impacts of climate change on health. So we need to be putting money into international efforts towards adaptation. And an adaptation is an interdisciplinary affair. So looking at food security and water and forest fires, these are things where health has some voice, but engineering has a tremendous voice. And agriculture has a tremendous voice. So it's a very multidisciplinary issue. And the final thing, I think, is that all of us as health professionals have a role to play in speaking up and having a voice, especially physicians and nurses and other health professionals. We're community-based, we're scientists, and we're trusted. And I think as such, we have a responsibility to speak up in our communities, to raise awareness, and to get Canadians involved in this at home and internationally. I think that the diseases provoked by climate change are not going to be new diseases. They're all diseases. They're heat-related diseases, they're malaria-related diseases, they're malnutrition, they're waterborne infections. Climate change is not unique in creating new diseases. It's going to magnify the diseases. It's going to make poverty, the impacts of poverty, worse. It's going to make it more difficult to achieve the Millennium Development Goals. So strengthening health systems is important overall and important in terms of climate change effects. But I would say that the greatest challenge of climate change is the interdisciplinary challenge, and is really, actually the greatest challenge is beyond the health sector. The health sector should have a voice and should have a role to play, but should speak out about the larger planetary problem, how we conduct ourselves as societies. The challenge of reducing carbon is something that is not health related, is not the health sector's issue. In some ways it is. In the national health in UK, it's one of the biggest segments of the economy. So the health sector has a tremendous role to play in greening the health sector. But it's a societal issue, and I think the health professionals and health professional organizations need to speak up in terms of the way we conduct our societies, and we better do it soon, I think. I think that the challenge is, this is the greatest, as the World Health Organization Secretary General, Dr. Chan said recently, climate change is the biggest public health challenge of the century.